name is Dr. Aaron Ritter. I'm a PGY3 resident, and this is my presentation on total ankle replacements. First, I want to talk about the numbers. According to the New York Times, on January 18, 2010, an article stated that 770,000 total hip and knee replacements are performed annually, and that approximately 25,000 ankle arthrodesis were done last year. 2 million patients visit the doctor each year for ankle pain, and 50,000 of these patients suffer from end-stage grade 4 ankle arthritis. 4,400 patients are expected to undergo ankle replacement in the next year. Total ankle replacements began with the first total ankle replacement implanted in 1970 in Hamburg, Germany, using a converted inverted hip prosthesis. In the 1980s, engineers designed a 3-component ankle joint with a mobile bearing. The goals with this mobile bearing joint were conservation of bone, rotational axis, tibial alignment of the foot, and biological fixation. The indications for total ankle replacement are rheumatoid arthritis with an average AOFAS score of 81.6. And these account for approximately 48% of all total ankle replacements. Osteoarthritis accounts for 24% of all total ankle arthritis, or total ankle replacements, with an average AOFAS score of 86. And rheumatoid arthritis accounts for 21% of total ankle replacements, with an average AOFAS score of 75. Quantifying ankle arthritis has been done by several physicians and institutions. The German SF36 scoring system, there's the ankle osteoarthritis scale, the AOS, the American Orthopedic Foot and Ankle Score, the AOFAS, and the Visual Analog American Orthopedic Foot and Ankle Score, the VAAOFAS. The ankle osteoarthritis scale is a tool that's used for assessing symptomatic ankle arthritis, a modification of the foot function index. Measures pain, disability with a 95% confidence interval. The scale is from 0 to 100, with the higher score indicating increased pain, and disability with a normal average score ranging from 10 to 15. Some authors have suggested that clinical studies using these instruments should be adjusted for concomitant musculoskeletal disease. There's the Caldron-Lawrence grading scale for ankle osteoarthritis, with grade 1 indicating doubtful narrowing of space, possible osteoarthritic lipping. Grade 2 defines is definite osteophytes with definite narrowing of the joint spaces. Grade 3 is moderate, multiple osteophytes, definite narrowing of the joint space, and some sclerosis, and possible deformity of bone contour, with grade 4 indicating large osteophytes, marked narrowing of joint space, severe sclerosis, and definite deformity of the bone contour. The treatment of osteoarthritis is varied. There is the oral medications, including the non-steroidal anti-inflammatories, and the use of steroids. Orthotic devices, such as custom orthotic inserts and bracing, such as Arizona braces or functional AFOs. Immobilization, steroid injections, and physical therapy. Additional treatment of osteoarthritis includes hyaluronic acid injections, Synvisc or Euflexa, arthrodiastasis of the ankle joint, ankle arthrodesis or fusion of the ankle joint, and total ankle replacement, which is also a joint destructive technique, whereas hyaluronic acid, arthrodiastasis are joint sparing.